Hey there! How's your tummy doing today? We're going to chat about the 7 warning signs of colorectal cancer, and it's super important to learn about this. Why? Well, it's the 3rd most common cancer and the 2nd deadliest. Sadly, about 10% of cancer deaths are caused by this type of tumor. So, stick around. I'm going to split this video into 2 parts. First, we'll cover the signs and symptoms of colon cancer, the things your body might be trying to tell you. Then, in the second part, which I think is the most important, we'll talk about prevention. This means things you can do to lower your risk, like good habits, healthy foods, and avoiding things that might increase your risk. We'll also discuss something called polyps, and why colon cancer is showing up more in younger people, even those under 50. It's going to be a really helpful video, so stay with me until the end. Oh, and before I forget, have you known anyone who has had colon cancer? Where are you watching from? Let me know in the comments below. Alright, let's get started. Symptom 7. Changes in bowel habits. It's really important to know your own bathroom routine. Some people go right after breakfast, others a couple of times a day, and some even just a few times a week. What's yours like? If you notice any changes in how often you go, how your poop looks, or how you feel afterward, pay attention. Changes happen, but if they stick around or get worse, it's time to see a doctor. About 65% of people with bowel cancer notice changes in their bathroom habits. These changes can be different for everyone and depend on things like where the tumor is, how big it is, and how far along it might be. You might see changes in how often you go, how your poop looks, like if it's more liquid or hard, or even its color. The main thing to watch for is more diarrhea that's not from a bug, lasts more than a few days, and then maybe you get constipated, then diarrhea again. Basically, any big changes, be alert. Symptom 6. Blood in the stool. This is why it's important to take a peek before you flush. What kind of bleeding should you watch for? Well, think of your large intestine like a winding road with different sections. The ascending colon, transverse colon, descending colon, and sigmoid colon, followed by the rectum and anus. The right side of your colon is a bit wider, and the poop there is more liquidy because one of the colon's jobs is to soak up water. So, if the tumor is on the right side, you might not have blockage signs, but you might see more bleeding. This can make you anemic, or your poop might turn black and tarry. Doctors call this melena, which also has a really bad smell. On the left side, the colon is narrower and the poop is more solid. Bleeding there might be bright red and drip into the toilet or show up when you wipe. Of course, other things can cause this too, like hemorrhoids, anal fissures, or even eating beads. But it's always best to get it checked out to be safe. Bleeding can be a little or a lot, and it happens if the tumor makes a sore in a blood vessel, if there's a wound in your bowel, or even if you've been straining a lot. Again, blood in your poop needs to be checked out. It doesn't automatically mean you have colon cancer, but it's always better to be safe than sorry. Symptom 5. Belly pain. If you've never had belly pain before and now you're getting bad cramps that come and go, or if it hurts when you poop, this happens when the tumor is near the rectum. Get it checked out. It might just be gas, or maybe you changed your diet. But if not, and the pain doesn't go away, see a doctor. Symptom 4. Fatigue and tiredness. This isn't just feeling tired because you had a bad night's sleep. This is being tired for weeks or even a month. With colon cancer, this can happen because of hidden bleeding. Remember how we talked about the tumor causing slow bleeding? That can make you anemic. If you're eating well and still feel super tired, you need to get checked out. One of the main reasons for anemia without an obvious cause is colorectal cancer. Cancer cells are like little energy hogs because they're constantly dividing. This can wear you out and even use up your nutrients, making you feel tired all the time. So don't ignore this symptom. Symptom 3. Bloating. Feeling bloated or having a swollen belly can be another sign of colon cancer. This can happen if the tumor is blocking things up, leading to gas and poop getting stuck. It can also make it hard for food and fluids to pass through, causing more bloating and even those colicky, crampy pains. So don't brush it off. Lots of things can cause bloating, but if it's unusual or happening a lot, see your doctor. Symptom 2, unexplained weight loss. If you're dieting and losing weight, that's one thing. But I'm talking about losing weight without trying. Like you used to weigh 154 pounds, 70 kilos, and now you're down to 143 or 139, and you haven't changed your eating, you're not feeling down, and you're not working out more than usual. Weight loss with colorectal cancer can happen for a few reasons. The tumor might be messing with how your body absorbs nutrients and calories, kind of like a little worm sucking everything up. It can also release things called cytokines that make you less hungry and cause you to lose weight. Plus, the tumor might make your body use more energy, leading to muscle and fat loss. It can even cause nausea and vomiting if it's blocking things up. Symptom 1, that not quite empty feeling. Doctors call this tenesmus. But first, go ahead and like this video. The more likes it gets, the more YouTube will share it with people who might not have easy access to doctors or hospitals. And don't forget to share it with your friends and family too. You could help save lives, so don't be shy. Okay, back to tenesmus. This is that annoying feeling like you still have to go, even after you've just gone, even when there's nothing left. It's like something's stuck. This is a common symptom of bowel cancer because the tumor might be partially or fully blocking things up, making it feel like there's still poop there when it's actually the tumor. When this happens, your poop might even change shape and become thinner like a ribbon because it's squeezing past the tumor. Important note: many people with colon cancer don't have any symptoms in the early stages. So, not having symptoms is great, but it's still important to know the risk factors and talk to your doctor about whether you should get screened for colon cancer, especially to check for those polyps we talked about earlier. What are colorectal polyps? Colon cancer usually starts with certain polyps that grow on the lining of your colon, called the mucosa. When the cells in this lining mutate, they can turn into these polyps. Most polyps are harmless, but over time, some can become cancerous. It usually takes about 10 years for a polyp to turn into cancer if it's not found and removed. Risk factors for bowel cancer. Like most diseases, bowel cancer has a few risk factors. Age. As we get older, our defenses aren't as strong, and a polyp that was dormant might become cancerous. Inflammatory bowel disease. Conditions like Crohn's disease or ulcerative colitis, inflammation in your bowel, increase the risk. In fact, 1 in 5 people with these conditions might develop colorectal cancer. Genetic syndromes. Some conditions like Lynch syndrome or familial adenomatous polyposis run in families and increase the risk of colon cancer. Family history. If someone close to you, like your mom, dad, brother, etc., has had colon cancer, your risk goes up. Taller people actually have a slightly higher chance of getting colon cancer. These are things you can't change, but here are some risk factors you can control. Cigarettes. Smoking doesn't just increase lung cancer. It also raises your risk for stomach, bowel, mouth, bladder, and many other cancers. Alcohol. Drinking too much alcohol also increases your risk. Sedentary lifestyle. We need to move. Diet. Eating a diet low in fruits, vegetables, and fiber, especially lots of processed foods, those with ingredients you can't pronounce, increases your risk. These foods are low in fiber and high in chemicals that might help them last longer on the shelf but aren't good for you. Also, too much red meat and saturated fat can increase your risk. Why is colon cancer increasing in younger people? The American Society for Preventive Medicine recently lowered the recommended age for a first colonoscopy from 55 to 45 for people at average risk. This is because younger people are eating more processed foods, not enough healthy foods, and aren't getting enough exercise. Plus, more people are overweight or obese, which also increases the risk. How to protect yourself. Here are 7 tips to lower your risk of colon cancer. And the last one is the most important, so keep reading. Drink plenty of fluids, especially water. Staying hydrated helps your bowels work better, prevents constipation, and helps flush out waste and toxins faster. Eat lots of fruits and veggies. These are packed with fiber and antioxidants. Fiber, like water, helps things move along and reduces how long waste sits in your colon. It also helps keep your gut bacteria happy. And try to cut back on red meat. You can still have some, just not too much, and especially processed meats, which are high in sodium. Eat spices and foods that fight inflammation. Things like turmeric and cinnamon are great natural anti-inflammatories. Drink milk and eat dairy. You might be thinking, wait, isn't milk inflammatory? But the latest research says no. Studies show that milk, yogurt, cottage cheese, and cheese might actually help protect against colon cancer. Of course, if you can't tolerate lactose or have a milk protein allergy, it's best to avoid them. Get moving. Don't just sit around. Exercise helps your bowels work better, balances your hormones, lowers inflammation, helps you maintain a healthy weight, and reduces stress. All of these things help prevent cancer. Avoid alcohol and smoking. We already talked about this, but it's worth repeating. Get checked out. At the very least, get a stool test to check for hidden blood. This test can find tiny amounts of blood in your poop that you can't see with your naked eye. But if you're over 45 and at average risk, it's even better to get a colonoscopy. Why a colonoscopy? A colonoscopy is different from other screening methods because it can find polyps before they become cancer. It's like catching something early and stopping it in its tracks. Then, the doctor can remove the polyp right then and there and you're good to go. What's a colonoscopy like? The prep is the most boring part. You have to clean out your bowels completely, so you'll take laxatives and go to the bathroom a lot until there's nothing left. But don't worry, you won't feel anything during the actual procedure because you'll be sedated. The doctor will insert a thin, flexible tube with a camera on the end through your anus to look at your rectum and colon. If they find a polyp, they'll remove it and send it to be checked. If there's a larger tumor, they might take a biopsy. The whole thing usually takes between 30 and 60 minutes. It's an important test because it can catch things early and prevent cancer. Early detection is key. Finding colon cancer early gives you the best chance for successful treatment and a full recovery. So don't wait. Take care of your gut health and keep your body healthy. Did you like the video? Remember to share it so more people can learn about this important topic. And what video are you going to watch next? I'll leave you with 2 recommendations. Don't forget to subscribe, and I'll see you in the next video. Thank you so much, and stay healthy.